A very lovely good evening to all of you. This is Dr. Pooja, and today we will be discussing about the metabolism of phenylalanine, right? So, let's to begin with the topic. First of all, we should know what kind of amino acid is this phenylalanine, what is the nature of this phenylalanine, and what is the metabolism. Because we have discussed in our previous videos also that phenylalanine is basically aromatic amino acid, isn't it? And what all we should know about this, that it is a essential amino acid. Now the question is why it is essential? Because it cannot be synthesized in the body, it has to be provided from outside diet. Okay, so if we talk about the nature, it is a essential amino acid. So nutritionally, it is very important. Now, why it is important? That means it must be synthesizing something. That is why it is important. So what are the, Usama Sheikh, good evening. How are you? I think you are a new joinee in my class. First time you are joining the class. Okay. So we have just started up with a new topic only, so you won't find any problem. Okay. So coming over to phenylalanine, it is a essential amino acid. Why it is essential? Because, okay, right. So we are discussing with the metabolism of phenylalanine. Beta, phenylalanine kya hai? It is basically an amino acid. And just now I wrote it is essential. Why it is essential? Because it is required. Okay, yeah, Mohammed Harun, good evening. It is required. Okay, I can see so many news joinees. No problem, beta. This is a new topic, so you won't find any problem in understanding. And my language is clear to all of you. I mean, like English is fine with you guys. English आता है समझ? Because what I do is I speak in both the languages. Okay, English also I speak, Hindi also I speak, and sometimes if I have to, use both the languages, I use English also. So you don't have to worry about the lingual part. Okay. So phenylalanine, why it is essential? Because it is required for the synthesis of, yeah, sure. I am also comfortable in English. So it is required for the synthesis of tyrosine. Now the question is, what is tyrosine? Because tyrosine is not essential. Okay. So tyrosine is required for the synthesis of so many important compounds in the body. No problem, Osama. I will use both the languages so that it is clear to all of you. I don't want to create any controversy also, so it will be clear. Don't worry. Okay. Now, what is the metabolism of phenylalanine as per carbon skeleton? Right. So, okay. Good evening, Khalil. How are you? Yeah. You are from Yemen. Okay, no problem. So I just want to welcome all of you who are the new joinees to my class. And since today is the first topic, so you guys won't have any problem. Okay. So if we talk about phenylalanine beta, I told you one thing. This is the generalized structure of all the 20 standard amino acids. And here it represents the R group. So this R group here, it consists of this type of structure. Okay, so what is this? This is phenylalanine. By looking at the structure, we can simply say since it is having this benzene ring, that means it is aromatic in nature. Right? Since it is aromatic in nature, what about the polarity? So being aromatic in nature, it has to be non-polar. So it is non-polar in nature. Right. Now, if we talk about the metabolism of amino acids, I told you one thing, and those who have joined for the first time, they can see my previous videos where I've told that metabolism of amino acids come under two subheadings. One is as per their nitrogen skeleton, and second is as per their carbon skeleton. Okay, as per their nitrogen skeleton, we have already discussed it that as per nitrogen skeleton, every amino acid is going to form urea. So I can say that the production of urea in the body is coming by the degradation of the amino acids. Right. Coming over to this carbon. So as per this carbon skeleton, this phenylalanine is both, means it is acting as a glucogenic amino acid, right, and a ketogenic amino acid. Now I'll just explain what is glucogenic and what is ketogenic. Gluco means glucose, right, and genesis is formation. So glucogenic means it is ready to form glucose, so it is glucogenic. Keto means it will give rise to some keto group. We all know that keto group is this. So it will give rise to keto group. So phenylalanine is acting as both. Means it is acting as a glucogenic as well as a ketogenic amino acid. So these are the normal properties of this, and this is the structure. Coming over to this, since we are discussing about the metabolism, and I have listed here that it is an essential amino acid. So what do you mean by this? So the most important point about this is that phenylalanine is converted to tyrosine. Right? That is what is its feature. And coming over to this, what is the significance of tyrosine? Right. This tyrosine is required for the synthesis of melanin in the body. Melanin beta, it gives the skin its color. So I can say that melanin is the skin pigment. Then tyrosine is required for the synthesis of T3 and T4 in the body. Right. Now what are T3 and T4? We all know that these are the thyroid hormones. So it is required for the synthesis of thyroid hormones also. Then this phenylalanine forms tyrosine, which is required for the synthesis of catecholamines. Catecholamines are very, very important hormones secreted from the medulla. Right? So these are the three very important products synthesized from tyrosine, and tyrosine which is synthesized from phenylalanine. So you can just imagine that what is the importance of phenylalanine in the body. I hope it is clear. Is it clear, beta? So when the topic is clear, just drop a thumbs up in the chat box. Okay, so I will have, okay, otherwise you can put a thumbs up in the chat box, and otherwise you can type yes. And if you have any confusion, don't hesitate to ask me. Okay, so now the question arises, what we are going to study in this metabolism, that how phenylalanine will be converted into tyrosine, right? How tyrosine will be converted into catecholamines, and how melanin will be produced. Okay, so first of all, we are going to take how phenylalanine forms tyrosine in the body. And always remember that whatever reaction occurs in the body, it is with the help of the enzymes for sure. So the reaction is this phenylalanine undergoes hydroxylation. Means, see, I'll just write the structure of phenylalanine. It is this, having this type of structure. CH2, CH, NH2 and COOH. Okay. When this phenylalanine is converted to tyrosine, it has this type of structure. Everything will be the same. CH2, instead of this, hydroxyl group will come here. Okay, now since all of you have studied just now, from your, like class 11th and 12th, this is para position, isn't it? So I can write it as para hydroxy phenylalanine, isn't it? So para hydroxy phenylalanine is nothing but it is simply tyrosine. So the other name of tyrosine is para hydroxy phenylalanine. Now coming over to the reaction, I am telling you that simply phenyl group, this hydroxyl group is attached. On which it is attached? It is being attached on phenylalanine. So what will be the name of the enzyme? So I can say that the name of the enzyme will be hydroxylase. And what kind of hydroxylase? Phenylalanine hydroxylase. Got my point? So I can say that phenylalanine, when it undergoes hydroxylation, it forms para-hydroxyphenylalanine, which is tyrosine. Okay. Now you have little bit idea about, see, this is the structure. Now you know that most of the reactions in the body are redox reactions. Okay, so if something is oxidized, other has to be reduced. So here what happens is, here another reaction comes into function, BH4. I'll tell you the full form also. BH4 is converted into BH2, which is linked with NADPH. Like this. So this is the complete reaction by which phenylalanine forms tyrosine in the body. So I can say enzyme is this, and this is reaction number 1. Now coming over to this, what is this BH4? This BH4 is actually tetrahydrobiopterin. Right? What is BH2? BH2 is dihydrobiopterin. Right? And here it will be reductase. Whose reduction? Dihydrobiopterin reductase. Right? Is it clear? You have to remember this reaction because beta, what is the role? Because whatever metabolism you are studying, you should know if there is any inborn error of metabolism, if there is any deficiency of the enzyme, it will lead to diseases in the body. And that is what is we have to find out the diseases. Right. So this is how it is synthesized. Now then second is, once this tyrosine is synthesized, then next step is this tyrosine is required for the synthesis of melanin. So this tyrosine will first of all undergo again hydroxylation, and it will form, yeah sure, I'll repeat it again. Jaswini, yeah, I'll repeat. But what I'm trying to tell you here is that phenylalanine is an essential amino acid. Why it is essential? We know what are essential amino acids. They are the ones which cannot be synthesized in the body and they have to be provided from outside diet. So why they are important? Because phenylalanine is required for the synthesis of tyrosine. A question is, What is the significance of tyrosine? This tyrosine is required for the synthesis of melanin, which gives a characteristic color to the skin. T3, T4, triiodothyronine and tetraiodothyronine and catecholamines, epinephrine and norepinephrine. Okay, so what I am trying to tell you here is that this is how phenylalanine is converted to tyrosine. The reaction is phenylalanine hydroxylase, right? And it forms para-hydroxyphenylalanine. Now is it clear? Now is it clear, beta? Okay, right. So once then this tyrosine is required for the synthesis of melanin. Ab how melanin is produced? What will tyrosine do? Tyrosine will again first of all form dopa, dihydroxyphenylalanine, and this is going to form melanin. Dopaquinone is produced and then melanin is produced. The main enzyme here is tyrosinase. Very, very important. So tyrosine is, one second. Okay, right. So tyrosine first of all undergoes splitting and then it forms melanin in the body, and this melanin is synthesized in the melanocytes, giving a characteristic color to the skin. Color to the skin, right? So this is how melanin is produced. Then we come over to the third one, ki how tyrosine forms catecholamines, right? So this tyrosine will again first of all undergo hydroxylation. The name of the enzyme is tyrosine hydroxylase, and it will form again dopa. Now dopa stands for dihydroxyphenylalanine. Right. Now this dihydroxyphenylalanine will undergo decarboxylation. Decarboxylation means removal of carbon dioxide. Decarboxylase. Right. And if we remove carbon dioxide from an amino acid, it is left with an amino group. So dopa will form dopamine. Right. And this dopamine will then, in the presence of vitamin C and the enzyme dopamine hydroxylase, will form the first catecholamine, which is norepinephrine. Right? And once this norepinephrine is produced, which is the first catecholamine synthesized from tyrosine. Okay, and this norepinephrine will then be converted into epinephrine. Now the question is how we convert norepinephrine to epinephrine. So here a very, very important reaction occurs, which is actually very important. What happens is methylation occurs. Means if we put a methyl group in norepinephrine, it will be converted into epinephrine. A question is from where that methyl group comes, isn't it? I can say that methylated form of norepinephrine is epinephrine. Let's put it that way. Right. Our question is from where this methyl group comes. So methyl group comes from methionine. Methionine, which is a sulfur containing amino acid. Methionine. Okay, so you should know that whenever we talk about methionine, the only function of methionine is that it provides methyl group to form various important compounds, and that is why methionine is also an essential amino acid. Clear? So I can say that now I'll just give you one example. Jaise whenever you have to go for an exam, for example, or whenever you are dressing for a party, obviously you will not go like this. You will dress properly and then only you will go for the party. Isn't it? You'll be active. Same is the case with methionine. If methionine has to transfer this methyl group, okay, if methionine has to transfer its methyl group, it has to be active. And the active form of methionine is SAM, which stands for S-adenosyl methionine. Right. So this S-adenosyl methionine will give its methyl group to norepinephrine. Okay. So epinephrine will be produced and it will be converted into SAHC, which stands for S-adenosyl homocysteine. Right. So I can simply say that this norepinephrine and norepinephrine along with epinephrine are produced by tyrosine. And how they are produced? You can simply say tyrosine will form dihydroxyphenylalanine. ठीक है and वैसे भी there is no need writing the structures, so if any student is interested in learning through structures also, they can contact me. Here I am not writing because otherwise it creates confusion in the mind. Okay, so tyrosine forms dopa, dihydroxyphenylalanine, hydroxylation. All of you are familiar with hydroxylation. Then dopa removes carbon dioxide. So when carbon dioxide is removed, the amino acid is left with only an amino acid. That is why it is dopamine. Then this dopamine is converted to norepinephrine, then norepinephrine to epinephrine. That's it. So these are the hormones secreted by the adrenal medulla. We all know that. We call them catecholamines also. Right. Up now see, this is how tyrosine is forming the important compounds. Now coming over to this was anabolic nature. Right. So what is the catabolism of tyrosine? Now, one thing you have to remember, whatever is synthesized in the body, it has to be degraded also. Okay, whatever is synthesized in the body, it is degraded, because if something is not degraded, if it stays back in the body, it will lead to diseases. And that is what is we are here for, to diagnose that. Okay, so if we talk about the catabolism of tyrosine, we all know that tyrosine is having this type of structure. CH2, right? And if we talk about the nature of tyrosine also, now can you tell me, any one of you, tyrosine is polar or non-polar? Let me see. My question is, beta, tyrosine is polar or non-polar? See, can anybody tell me just by looking at the structure, if we compare the polarity of tyrosine with phenylalanine, it is polar in comparison to phenylalanine. Why? Because of this group. What my point? So tyrosine is polar because wo electronegative oxygen is there, polarity will be there, and because of this hydrogen bond also. Now we are going to study the catabolism. Now see what happens is there is, because we have to just dismantle the entire structure, means whatever structure is there we have to break this structure. So what happens is this tyrosine undergoes transamination, first of all, being an amino acid. So first process is always transamination. So the enzyme is transaminase, and this reaction takes place in the liver. So it is hepatic transaminase. Polar, since yes, exactly, you are right, Jaswini, it is polar. Why it is polar? Because you can see this hydroxyl group. Okay, and this is the basic difference between phenylalanine and tyrosine also. So in the presence of transaminase enzyme, it forms para hydroxy phenyl pyruvate, right? Then this para-hydroxyphenyl pyruvate undergoes splitting in the presence of dioxygenase enzyme. So the enzyme is dioxygenase, okay, and it forms a very important intermediate which is homogentisate. Now these intermediates, everything beta you have to learn. So what happens is this tyrosine undergoes, first of all, being an amino acid, it will undergo transamination, okay, forming para-hydroxyphenyl pyruvate. This para-hydroxyphenyl pyruvate will split up, forming homogentisate. And this homogentisate will now undergo oxidation. And we know the enzyme required for oxidation is oxidase. And it forms this type of compound. 4-methyllyl acetoacetate, right? But these actually you have to learn because they are very important. No doubt initially beta you will have a problem in learning this terminology, but slowly you will learn. Okay. Then comes this 4-methyllyl acetoacetate. It has an isomer. So enzyme is isomerase and it is converted into 4-fumaryl acetoacetate. Right. So this is how in this rhythm it is going to homogentisate. It forms 4-methyllyl acetoacetate, then 4-fumaryl acetoacetate. Then this 4-fumaryl acetoacetate will undergo splitting. Very important. And the enzyme here is 4-fumaryl acetoacetate hydrolase. And always remember this acetoacetate splits up into fumarate and acetoacetate. Right? Clear? So now see, if it is forming fumarate and acetoacetate, we all know that fumarate is a link to TCA cycle, isn't it? So obviously we can say it is glucogenic. Acetoacetate will give rise to acetoacetate, means keto group. So it is ketogenic. That is what I was trying to explain, that tyrosine and phenylalanine are both glucogenic as well as ketogenic amino acids. Is it clear, beta? This is the fate. Got my point? Any confusion till now? So this is how, right. So this is how we study the metabolism of tyrosine. Okay. Now, since we are studying medicine, so we have to know this, that if tyrosine is being synthesized, if tyrosine is forming melanin, if any enzyme is absent, what will happen to the body? That is what is the importance of biochemistry. That if a particular enzyme is absent in the body, it will lead to what? So now what we call them as inborn error of metabolism. Inborn errors of metabolism. Okay. Now, if I talk little bit genetics, I'll just tell you superficially. We all know there are different modes of inheritance. All of you have studied Mendelian inheritance, non-Mendelian inheritance. You know that autosomes are there, sex chromosomes are there. Some are autosomal recessive disorders, some are autosomal dominant disorders, some are X-linked recessive, some are X-linked dominant, some are maternal or mitochondrial inheritance. So this is what we will be studying. So that will all come under inborn errors of metabolism. Clear? Now, first disease which we are going to study here is very, very important, phenylketonuria. Phenylketonuria. Now, it is abbreviated form is PKU. Now, coming over to this, how phenylketonuria is produced. If I talk about this reaction, we all know that just now I discussed that phenylalanine is converted into tyrosine. Right. Enzyme here is phenylalanine hydroxylase. This is the enzyme I was talking about. Suppose if I say this enzyme is absent, what will happen? The concentration of phenylalanine will increase. That means phenylalanine cannot be converted into tyrosine. Okay. Now what will happen is, if the concentration of phenylalanine increases, it will be diverted. So I can say that no melanin will be there. No melanin, no epinephrine. Right. Now see, when the concentration of phenylalanine increases, it is diverted. It will be converted into phenyl pyruvate. We all know alanine can be converted into pyruvate, right? Phenyl pyruvate can be converted into phenyl lactate, right? And it can be converted into phenyl acetate. Right? So I can say that phenylalanine's increased concentration is going to form phenyl pyruvate, phenyl lactate, and phenyl acetate. Now all three are what? They all are keto acids, isn't it? If we talk about pyruvate, pyruvate also has double bond. O, C double bond O. Lactate also has C double bond O. Phenyl acetate, acetate to hai CH3COH. Okay. So since phenyl pyruvate and acetate are keto acids and their concentration increases, so increased concentration of these keto acids will lead to phenylketonuria. Okay. Urea means increased concentration in urine. Whose concentration will increase? Phenyl ketoacids. Clear? Right. So this is very, very important. Phenylketonuria. The deficient enzyme here is phenylalanine hydroxylase. Now, phenylalanine tyrosine, one second. Now, if we talk about this, what are the clinical features? If a person is suffering from phenylketonuria, what are the clinical features? सबसे important is pale color of skin, isn't it? Why pale color of skin? Because no melanin is there. Clear? Second is no epinephrine, epinephrine and norepinephrine will be synthesized. So it will lead to low IQ level of that child. So low intelligent quotient will be there. Okay, so you can say little bit of mental disturbance will also be there. Little bit of mental disturbance. Okay, so these are the clinical findings of an infant suffering from phenylketonuria. Okay, अब how do we assess? देखो basically what we should know beta in inborn errors of metabolism, एक तो we should know what are the symptoms. Yeah, hi, good evening. Yeah, I am good. How are you? Yes, I am coming to that, Jaswani. This is very important. How do we detect that the patient is suffering from phenylketonuria? Very good question. That is biochemical diagnosis. Right? Basically, it affects the infants. Okay? Biochemical diagnosis. But it is not very harmful, beta. Why? Because if phenylalanine is not being converted, if phenylalanine is not being provided, we have to give tyrosine to that child. Why? Because, see, this is the only reaction, no? So if phenylalanine is not being degraded because of the absence of this enzyme, we will give tyrosine. So their tyrosine will serve as an essential amino acid. Right? So this becomes a sparing action that I will be discussing now also. Okay? So biochemical diagnosis is ferric chloride test. One is ferric chloride test. Right, but this ferric chloride test is answered by so many. Whenever we have to detect other diseases, also ferric chloride test is also carried out. But here, the widely accepted test is Guthrie's test. The test, which is the most sophisticated test, that is Guthrie's test. And basically, karte kya hai, what we do is we take the blood from the heel prick. Heel hota hai na, of the child. We take the sample from that heel. Why we take the sample from heel? Because it is less painful, because the child is already just born, it is difficult to take the blood. So we take from heel sample. So heel sample blood we take. Okay, and the child is already breastfed, so he is taking mother's milk also. That is another thing. Now, what will happen is this Guthrie's test may we take a Petri plate like this. Okay, so here the enzyme, the bacteria is Bacillus subtilis. So what we do is we inoculate this Bacillus subtilis is already there, no? We inoculate the sample here. The sample. Okay. Now see what is happening here is this Bacillus subtilis needs phenylalanine for the growth. Okay. From where it will be provided? It will be provided from the sample, because sample may, if the child is lacking phenylalanine hydroxylase, what will happen is that means phenylalanine will not be converted into tyrosine. So that phenylalanine will enter here. So if positive colonies are there, we say the test is positive. And if no colonies, that means no test is there. So Guthrie's test is considered to be the widely accepted and authentic test to detect phenylalanine. Clear? Because ferrichloride test, slowly you will understand other diseases also from there. There also ferrichloride test is done. This is most important. Now the most important diagnostic criteria is the diapers. Okay? The diapers of the child will have mousy odor, mousy or musty odor. Very important. Matlab, if a child comes to you and you have to identify the moment you open its diaper, even the parents will also complain of this, that musty, mousy, as if some rat is killed somewhere. So this is a clear indication of that the child is suffering from phenylketonuria. Then you will go for other symptoms also. Getting my point? So this is phenylketonuria. This is the most important diagnostic criteria. And you will see better in most of the amino acid inborn errors of metabolism, you will see there are so many different type of characteristic urine odors. Somewhere you will find it as musty odor, somewhere you will find it as cat urine kind of thing. So this gives a clear indication that this amino acid is present or this enzyme is absent, like that. Okay, so if I talk about phenylketonuria, I can simply say the infant will be mentally retarded, little bit low IQ will be there, and obviously epinephrine, norepinephrine won't be synthesized, so he will little bit be towards that side, and musty odor will be there when you open the diaper. Clear? Then second disorder is albinism. Okay, second is I told you that tyrosine is converted into, do we have any color change? But a color change, so as such, it won't be there, it won't be oxidized as such, but yes, it will give this foul odor. That's it. Jaswani. Okay. Now we come over to the next one. Now see, if I say second is albinism. Now what happens is, we know that tyrosine requires tyrosinase, okay, to get converted to melanin, right? If I say this enzyme is absent, what will happen? Melanin will not be synthesized. It's clear? So if melanin is not synthesized, what will happen? It will lead to albinism. Albinism will be, the whole body will be like albino rats and all we study. Now whole body will be white. Right? So we can say that albinism is due to tyrosinase. And this is a genetic disorder, obviously. And this is autosomal recessive also. Okay. Then one more thing is there related to this. Albinism is the person is completely white. But you must have observed certain people, who have white patches somewhere here, near the mouth, on the hands, sometimes around the nipples. So that is vitiligo. So there is a difference, vitiligo. Vitiligo and leukoderma, these are the things where the color of the patches will be different. Okay, but they are not related to tyrosinase. Right? So this is albinism, where we can say that absence of tyrosinase enzyme is there, which leads to albinism. Right? Then after this, then we come over to the third disorder, a very important one, Alkaptonuria. Okay, yeah. Now see beta, what is Alkaptonuria? First of all, the deficient enzyme here is homogentisate. This enzyme you have to learn. Gentisate oxidase. The deficient enzyme is homogentisate oxidase. Now I will just write the reaction here. What happens is, we know that this is the reaction which is going on. Para-hydroxy phenyl pyruvate. Okay. It gets converted into homogentisate. Now you have to just understand this, and this homogentisate in the presence of oxidase enzyme forms this. Okay, now if I say this enzyme is absent, right? Whose concentration will increase? The concentration of homogentisate will increase. Isn't it? Because the enzyme required to convert homogentisate to this is absent. So this homogentisate will then be converted into, it will be oxidized. So it will be oxidized to form alkaptones. Right, means absence of homogentisate oxidase leads to the formation of alkaptones, and these alkaptones are actually quinoacetates. ये क्या करते हैं? Wherever they are present, no, they will lead to hardening of that particular area. They hardens. Basically, here in the pinna, they will harden. To harden the pinna of the ear, right? And sometimes what happens is the vertebral disc, they are deposited in the vertebral disc also. So whenever we conduct the x-ray, we can see that vertebral disc mein stratification is there. So in the intervertebral disc, right? So we will see the deposition of alkapton type of bodies. So they are alkapton bodies. Okay. Now the most important thing here is, since I am saying that since they are hardening that particular structure, that hardening is known as ochronosis. Ochronosis is basically hardening. And if this ochronosis affects the joints में भी होगा, so it will lead to what? It will lead to ochronotic arthritis. Very, very important. Okay, so if this hardening takes place in the joints, it will lead to ochronotic this arthritis. So obviously movement will be affected. Okay, up the question arises here that first of all, what is the diagnosis? Very, very important. So if I have to tell you about the biochemical diagnosis here, always remember beta, here urine turns black on exposure to air. Just now, Jaswini, you asked about the urine, no? Here, urine will turn black. urine will turn black on exposure to air. Right. Now, the question is why urine turns black on exposure to air? Because homogentisic acid has to be oxidized. If it is not being oxidized in this way, it will be oxidized there. And how it will be oxidized? Because if the sample of urine is kept as such, you will see that it turns black. इसको हम बोलते हैं, we call it as coke color urine. Just like coke color. That is why it is coke color of urine is there. Clear? And it will give Benedict's test positive. It will give Benedict's test also positive. Why? Because it is acting as a reducing agent. Right. This is the biochemical diagnosis. Now, what is the treatment? How we treat that patient? अब treatment के लिए we give him this medicine nitisinone, right? So what is the function of this nitisinone? Nitisinone inhibits this enzyme para hydroxy phenyl pyruvate dioxygenase, right? So if I take you to this reaction, ye dekho, if we give nitisinone here, so nitisinone will inhibit this. So automatically homogentisate acid concentration will decrease. Got my point? Is it clear? This is Alkaptonuria. And here also I forgot to tell you about this. What is the treatment here in phenylketonuria? Here tyrosine becomes essential. Becomes essential. Right. Because tyrosine, so that melanin and all are synthesized, and we have to give that patient basically cassava diet. Cassava diet means plant-based diet which lack phenylalanine. Right. No, beta. No, there is no time duration as such because oxidation is there. No. So if you leave something open, okay, so it will be oxidized. If you keep coke also, na, coke, the color of the coke remains the same. Same is the case here. It is neither darkened, it is not lightened. So it will be like that. The only thing is that homogentisate, instead of being oxidized in the body, it will be oxidized outside. Clear? And coming over to this Alkaptonuria, beta, if we talk about the onset of disease, okay, onset of this disease is said from 30 to 40 years. Right. So this is Alkaptonuria. And then we come over to, this was the, which one? One second. Third one. Then we come over to the fourth one. Now here, what you have to remember is, I'll take you back in the degradation of tyrosine. I'll just write it and then I'll show. Tyrosine forms para hydroxy phenyl pyruvate. Okay, this I have already told you. This forms homogentisate, right? Then this homogentisate forms 4-mellyl acetoacetate, and this forms 4-fumaryl acetoacetate. This all I have just told you, so I don't think I need to repeat this. And then it forms fumarate and acetoacetate. right? And I'll just write the name of the enzymes here. Here the enzyme is transaminase. Okay, here the enzyme is dioxygenase. Here the enzyme is oxidase. Here the enzyme is isomerase. And here the enzyme is hydrolase. Right? Now see beta, if I talk about the inborn errors of metabolism, I can say this enzyme can be absent. This enzyme can be absent. This enzyme you saw just now. This enzyme to isomerase and this enzyme. Right. Now, if any of these enzymes will be absent, it will lead to increased concentration of tyrosine. So, whenever the concentration of tyrosine increases, we call it as tyrosinemia. Right. Now, if I talk about the absence of hydrolase enzyme, I can simply say this is tyrosinemia type 1. Right. Transaminase is tyrosinemia type 2. Right. This is tyrosinemia type 3. And here I just now told you it is Alkaptonuria. Right. So you can see that absence of tyrosinemia type, this absence of, I'll just write it like this. Okay. I'll just make a table like this. Okay. Here I'll simply write the deficient enzyme. Yeah. I'll write the disease. And then I will write the deficient enzyme. Here I will write clinical features. Now see beta, when hydrolase enzyme is absent, but you have to name the entire enzyme. It is 4-fumaryl acetoacetate hydrolase. Disease caused is, okay, it's clear. Thank you so much, Queen. So that it is all the topics are clear to all of you. These are very, very important topics, beta. Very important. So if fumaryl acetoacetate hydrolase is absent, it leads to tyrosinemia type 1. And if we talk about the clinical features, it is a very fatal disease. Very fatal. It is difficult for the child to survive also. So failure to thrive. Right. And in this, the urine gives a cabbage type of, that cabbage, when the cabbage gets rotten, so it gives that smell. So cabbage like odor is there. Right. So tyrosinemia type 1, how do we differentiate if the patient is less fumarate or acetoacetate? But acetoacetate, normally, whenever this acetoacetate breaks, no, it gives acetone. So we can get that smell of acetone in that patient, that breath. Otherwise, fumarate mate is not possible. And moreover, if we talk about this and this thing, the concentration of this will increase, no? So fumarate and acetoacetate, there is no question. They will not be produced. That is why it is fatal. Getting my point, Jaswini? Just because this hydrolase enzyme is absent, fumarate and acetoacetate, तो वैसे भी they cannot be produced. That is why it is risky, it is dangerous, it is fatal. Okay, and otherwise just remember acetoacetate beta वैसे भी it gives acetone, so just keep this thing in mind, right? Then again the tyrosinemia type 3 we will take. Type 3 is also very important, where the deficient enzyme is dioxygenase. Okay. Here also, if we talk about the clinical features, main is it is going to affect the skin and the eyes. So we call it as oculocutaneous, right? And here the smell is like, it's like, that swimming pool odor type of smell is there. Swimming pool odor. And sometimes we call it as Hawkinsinuria also. Right. So these are what? These are the inborn errors of metabolism associated with phenylalanine, and this is the metabolism of phenylalanine. So if I have to summarize the entire metabolism, I can simply say that phenylalanine, okay, it is non-polar, very, very important. It is essential, right? It is glucogenic and ketogenic, right? And it is converted into tyrosine. And we know that tyrosine synthesizes what? Melanin, right? And epinephrine and norepinephrine. This, yes, catecholamines. Right. Now, one disorder, again, I will just like to tell you what happens sometimes is whenever there is a tumor in this tumor of the medulla, what will happen? The concentration of catecholamines will increase, obviously, right? And these catecholamines will be degraded. And when they are degraded, they form metanephrines and nephrins, which are excreted in urine, right? So what happens is we call it as, this disorder is known as pheochromocytoma. And this metanephrine and this nephrins, basically they excrete VMA in urine, which stands for vanillyl mandelic acid. And what happens is whenever the concentration of degradation of epinephrine and norepinephrine are increased, so इनका function क्या है? Because they are actually released in fire, fright and fight. So automatically the person will be in total hypertension. Hypertension will be there. Profuse sweating will be there due to that hypertension. Okay. Right. So this is all about the inborn errors of metabolism. And here we finish up with the metabolism of phenylalanine. I hope it is clear to all of you. And what I'll do is I will just share this entire material in my Telegram channel also. So you can, if you guys want to have this PDF, so PDF you can have from this channel. Biochemistry by Dr. Pooja Johari. So you can have the access of this PDF also. Clear? Any confusion till now? Yeah, everything is crystal clear to all of you? If yes, then you can give me a thumbs up also. Okay, right. Right. So we will just wind up the session, and the PDF access you can have on my Telegram group. I'm just sharing it now. So if there is no problem at all, we can wind up the session. So good night all of you. Take care. See you guys tomorrow. Right? Okay. Good night all of you. Yeah. Bye-bye. Yeah, thank you so much for giving me the thumbs up. Thank you so much.